Hey, everybody. Welcome back to Autism Confidential, the podcast from the National Council on Severe Autism. I'm Jill Escher. I am your host, and I'm the president of NCSA. And today, again, we are extremely grateful and lucky to have Dr. Manuel Casanova as our guest. I gave a pretty long introduction of Dr. Casanova in the first of these 3 episodes, so please listen back for that. But he's currently retired, but I kind of put quotes around retired because he continues to be engaged in the science, and he's writing now his 19th book. What is the book about, Dr. Casanova?
Well, it's about the history and controversies of autism.
Oh, okay,
It's
good.
one of my favorite subjects. It will be published by the daughter of a very good friend, Olga Bogdashina, who's a very famous instructor, teacher in regards to autism and an international figure. She's presently in England, but a very big figure also in the autism of Russia.
Does the book have a name yet?
No.
Okay. Do you think it'll be published this year?
Yes.
Okay. Well, we will look forward to it. When it's out, I will announce it on the podcast. So the first episode, we talked about Dr. Casanova's specialty, which is really about neuroanatomy and microstructures of the brain and how those are abnormal in autism cases. The second episode, we did a kind of free-flowing dialogue about various controversies in autism, including the question of neurodiversity and some, challenges and failures in the autism research field. And then this is our third and last installment, and this is really in response to a listener request. And this person asked for an episode about transcranial magnetic stimulation, or TMS, and its use in autism. And actually, Dr. Casanova, I believe, was the first person to study TMS in autism. Isn't that right?
Yes.
Yeah.
You're correct.
Yeah. So, I think, we're so lucky to be able to have him address this. And I do want to say, everybody, we've been getting wonderful suggestions for both guests and for episode subjects. We'd love to hear from you. Just email us at info@ncsautism.org. Okay. So without further ado, Dr. Casanova, when we ended our last episode, you were talking about the need for more research, more funding on interventions that could actually address some of the core origins of autism, and that is neuromodulation. Let's talk about it. Let's pick up where we left off. And then we'll go directly into TMS. When you talk about neuromodulation, can you explain what you mean?
Yes, these are techniques that usually are non-invasive and change the way the brain behaves. You modulate the neurons, the neuronal activity, by means of external manipulations. It could be TMS, but there are a number of different entrainment techniques, some that are well known, some that belong to research, and many that people are not even conscious or aware of. The way that old shamans used to drum their music and people danced to them and they went to a trance was a type of neuromodulation created by auditory stimuli. You can train the brain by using your senses. It can be auditory stimuli like the shamans. It can be visual stimuli. And people that are photoreactive and that can even develop seizures to strobe lights are clear examples of the visual effects on the brain. So you can use other types of waves besides acoustic or light waves to modulate the activity of the brain. And one of them is a magnetic flux fields. There's a particular law in terms of physics. It was Faraday's law that said that if you pass a current through a conductor in a closed circuit, it would generate a magnetic field. Okay, so if we do that and we create a magnetic field by passing a current through a conductor, which is coiled upon itself in order to increase that magnetic field, it will have an effect in the brain because the skull is actually transparent to electromagnetic radiation. It's great for protecting the brain against trauma. That was basically its purpose, but it's completely invisible to magnetic radiation. And what happens is that the brain and the cells, the neurons in particular, they are like balloons filled with electrolytes. So they are excellent conductors of electricity. Okay, those ions inside of those balloon-filled bags of liquid are able to be excited by a magnetic field. And depending on the strength of the stimuli, you are able to even make those neurons fire. And depending on the frequency of that fluctuating magnetic field, you can either inhibit neurons in a particular brain region, or you can excite the same. So it's wonderful because it's a way of training the brain to act in a particular way. And that would be transcranial magnetic stimulation.
And is that so? Okay, so that therapeutically though, it has a well-established background, right? Let's go outside of autism,
Yes.
right? TMS is well established as a modality, right? For some indications. Can you explain how it's used outside of autism?
Well, again, I was talking about the frequency component and how if it's a very low frequency, you could have an effect of depressing a particular brain region. Or if you use very high frequencies of stimulation, you could actually excite a particular brain region. Some of the literature suggested that different brain regions of the brain were affected in people with major depression. And many patients with major depression are refractory to drug therapy. So one person had the idea that for refractory depression, they could try to stimulate the brain by using high frequencies of TMS. And right now, that's an accepted modality of treatment for major depression, treatment refractory, and it has been approved by the FDA. It has proven to be life-saving for some individuals. But from there on, there have been many different applications in regards to like Tourette syndrome and many other neuropsychiatric conditions.
Oh, does it help with Tourette syndrome? I didn't know that.
Yeah, for some cases of Tourette syndrome, yes.
Okay, interesting. So where did the interest in trying this with autism patients come in? How did you were the first person, so you can give a real account.
Yeah, it was sort of interesting, but we had done a lot of studies in regards to the anatomy and neuropathology of autism, and we had found that certain structures within the cerebral cortex called mini columns were affected, and that it was the peripheral compartment where you had the inhibitory surround of the mini column that was primarily affected. The core compartment that conducted the stimulation was unaffected, but the peripheral compartment where you had all of the inhibitory cells keeping the stimuli within the mini column, providing contrast in between the stimulation of one mini column and another. That peripheral surround was affected.
Right.
Well,
In
it
the
just
first
so,
episode, you talked about it like a missing shower curtain.
like a missing shower
Yeah.
curtain. Well, a shower curtain drapes, okay, the bathtub. It actually flows vertically and prevents water from going outside of the bathtub into the floor. It's the same thing with this shower curtain of mini columns. It drapes the mini column in a vertical fashion.
Mm-hmm.
And from basic physics, and it just so happens that electronics has been a long-standing hobby of mine. It is well known that magnetic induction depends on orientation.
Mm-hmm.
If you were able to engender a magnetic field within an area of the brain to which the conductors or anatomical elements were oriented properly, you would have a significant effect on that area. And it just so happens that if I apply a magnetic field and this shower curtain of inhibition is standing vertically throughout the cortex, I can actually reinforce that shower curtain of inhibition. I can inhibit the inhibition because they are properly aligned. The outside magnetic field with the mini columns inside of the cerebral cortex. So I said, well, you know, I had never used TMS before, and it took me like 2 or 3 years to actually get the machine, the experience. Primarily it was the machine because I had to pay practically all of it out of my own pocket.
Oh my goodness.
And they were expensive.
Was this when you were on the faculty in Louisville?
Yes.
Yeah. Oh, wow. Okay. You were motivated. That's I'm impressed.
I had the idea while I was at the Medical College of Georgia, and I moved to Louisville. I carried that idea and I said, that really cannot die. Let me try it on. And we had our first study. And from there on, we did like 15 studies overall and reported over 400 patients easily within the literature that received the active treatment, and an equal number of waiting list controls that upon the end of the study, they were invited to receive the active treatment. So overall, we treated well over 800 patients with significant positive results. And I can tell you, it was.
And these were high functioning. Let's be clear. These patients were a high functioning population,
well,
right?
The problem in here is that we were doing outcome measurements that require the participation of the patients. They had to engage with a computer, answer questions, keep their attention, follow instructions. And in that regard, we limited our studies to patients that were like 8 years of age and older. But we had experience in some younger individuals, but those that we reported were 8 years of age and older, and they tended to be high functioning autistic individuals.
Right. Okay. So back to your results. Sorry, I had to insert that.
We actually collected a lot of different outcome measurements. We're the first to use EEG along with TMS and record brain waves. We use gamma frequencies, the higher frequency brain waves, as an outcome measurement, and got some fantastic results in that regard. And then we also recorded autonomic measurements for safety purposes and had some fantastic results in that regards also.
When you say autonomic measurements, what do you mean?
Well, the autonomic nervous system is part of the nervous system that modulates the activity of viscera outside of conscious control, like breathing, heart rate, digestion, those activities. And it's markedly impaired in autistic individuals. Usually you have increased sympathetic tone, which promotes the fight or flight response in patients. And autistic individuals have this hyper alertness dictated by this increased sympathetic tone. And they have, to counteract it, a parasympathetic tone, but it's not acting efficiently. It's lower. So you have high sympathetic and very low parasympathetic tones.
Okay.
It's very important. I will tell you that a lot of the, first of all, one of the things that we try to describe is that even though we're talking about the peripheral nervous system, it's all modulated by the activity of the brain, especially the frontal lobe. And you could control the peripheral nervous system by stimulating the brain.
Okay.
And many of the different symptoms that you see in autistic individuals, even in terms of digestion, GI abnormalities, may be derived from the autonomic nervous system. But more importantly, you are probably not aware of this. What we found was that there were abnormalities of heart rate in our autistic individuals. And when they came in and they were at a basal level, it was rampant throughout the whole population.
Abnormal heart rate.
Yes. Yeah.
Okay. I mean,
Well,
was it too high? I didn't know it. How was it different?
Well, it's incredible. But the normal thing for heart rate is to be abnormal in terms of rhythm. Whenever you say a heart rate is 60 beats per minute, it's not that you have 1 beat every second. But if you do an EKG, 1 beat may be in 1 second, the next beat may be in 2 seconds, the next beat may be in half a second. And there's this variability, okay?
Oh, okay.
And that's normal. Whenever you lack that variability, and it's completely normal, 1 beat per second, okay? That's the abnormal part, and that predisposes a person to arrhythmia and sudden death, sudden cardiac death. And in autism, there's an increased susceptibility to sudden cardiac death. And there are maybe a few thousand people per year that die. And it has been attributed to the fact that they also suffer from seizures. And sudden death, sudden cardiac death in people with seizures is very common, okay? It's an accepted phenomenon. But people believe that the sudden cardiac death in autism is because they were also epileptic. And we believe that it was because of the heart rate abnormality. Seizures may be superimposed, but it was the heart rate abnormality. And you could treat that with TMS. Okay, believe it or not.
Okay, this is all new to me. Wow. Okay, and so you found that when you did the study? You found that the TMS?
One of our studies had 120 patients, and it was the report on the autonomic findings. That finding has been reproduced by others, so it's well known and accepted as of present. What hasn't been accepted is that you could treat it prophylactically with TMS, because all of that peripheral abnormality in terms of the autonomic nervous system is mediated by the prefrontal cortex. The prefrontal cortex acts as a brain to the limbic system that sort of guides the autonomic nervous system, okay? whenever you take that break away, then you get abnormalities of the autonomic nervous system.
Wow. Okay. That's so fascinating.
Mhm.
How about with respect to the autism symptoms themselves?
Yeah, we gather information in regards to behavioral screening, and TMS proved valuable in terms of significantly reducing repetitive behaviors. It also improved some central core abnormalities in terms of higher cognitive functions.
Hmm.
People usually talk about theory of mind being affected in autism. It's very difficult to do a TMS study and theory of mind. What we used was error monitoring. And what happens in autism is that whenever you are given a task that involves choosing, making a selection multiple times,
Mm-hmm.
okay, in a sequence, sometimes they will commit a mistake. They won't be able to follow instructions, okay? A normal individual uh, will actually pause and realize that they have committed a mistake whenever they do one,
Hmm.
and that's normal. An autistic individual commits a mistake and continues in a sequence without pausing.
Okay.
And that's called an abnormality in terms of error monitoring.
Error
And we
monitoring. Okay.
and we found that, and people believe that it's part of impulsivity, that people that have abnormalities in terms of error monitoring are also impulsive, and many of them have ADHD and so forth in terms of the autism spectrum. They have that comorbidity. We found that TMS markedly improved that also. If
Mm.
you ask me how about language, will a nonverbal start talking with TMS? No.
Mm.
Okay. Will a person stop being autistic? No, no. Will it help them in terms of impulsivity, in terms of stereotypy, in terms of autonomic nervous system abnormalities? Then I would say yes.
Mm.
Many of our patients slept better, they felt better.
Well, sleep's a huge issue, as we know, in autism.
Oh,
So
yes.
that in itself, would
Mhm.
make the intervention worth it for many people.
Oh, yeah.
Yeah.
Yeah, it's a pity that it hasn't been pursued properly. We had problems. We wanted to do like a major FDA approved trial and recruit hundreds of individuals, and we had the patient population,
Mm-hmm.
and also one where we would follow them over time, maybe after several years. And either I moved universities and lost those populations,
Mm.
or never received the funding, or then just retired. Uh,
Well, I think um, there are some studies now, as I understand it, even though you have retired, there are other labs, right, that
mhm.
are looking at the use of TMS in autism. Are you aware of these studies?
Oh, yes.
Yeah.
I'm also aware of some commercial ventures that have implemented the technique.
Yes, there's one here in the Bay Area. I live in the SF Bay Area, as you know, called MERT,
Mhm,
MERT therapy,
mhm, mhm,
that they are selling for I think $10,000 a pop to autism patients. I don't know if they really have data to support their work. I think there's anecdotal evidence that it's helpful around the edges.
mhm.
But
Well,
our
that's the problem, because many of these commercial ventures really are there for the money, and they generate a lot of it. They also expand, and they have multiple regional offices, even internationally, and they don't publish their findings.
right.
They don't have control studies. They say that their techniques are markedly positive and provide for significant results, but show me the proof and they don't have anything. I have received
they're doing it on patients sometimes with what we would call severe autism, right?
and I will tell you that we did try it on some patients with severe autism, and we didn't have positive results. The thing is something that you call attention to before, that if you had an anatomical abnormality within the brain, if you had all of these malpositioned neurons within the brain, some clusters that fail to migrate properly to the cerebral cortex and provided for recalcitrant seizures, a physiological method is not going to correct a structural abnormality.
Right.
So for many of the more severe patients in the spectrum, this is not a viable alternative unless you just want to lose your money.
Well, is it? I mean, they are studying it. I think with different autism populations. I'm not too familiar with the current studies, but do you think there is any hope for TMS having relevance? And we talked about autonomic nervous system. We actually talked about sleep as well. But for the autism symptoms, do you think that there's any hope? Is it worth studying? I mean.
Well, I will tell you that we also reported abnormalities of gamma brainwave functions, those that actually coordinate different activities in brain regions, both intra-area and between different regions of the brain. And there were marked improvements, but one of the things that we found is that by establishing the baseline level of gamma brainwave abnormalities, we could predict which patients were going to improve with the TMS therapy. So there are ways of actually telling you and testing the patients without having to waste $10,000.
You can predict based on, again, was that an EEG, or how did you get the?
We did the EEG/evoke potentials.
Evoke potentials. Okay.
Right.
And so that would predict.
Right, because the thing is that the complaints of patients, and I receive emails practically daily in regards to this, and I have a lot of complaints. And what they tell me is that they will be charged $10,000. And it's not only that, but the inconvenience for the family to actually uproot, move, and stay somewhere else for like 1 month.
Right, because these are daily, aren't they daily treatments for the most part?
And at the end of that treatment session, they will be confronted with EEG findings saying, well, the patient improved markedly, significantly. If they received another course of therapy, another $10,000, okay, who knows what the findings will be? Maybe a lot more improvements. And in the end, it's not only a financial inconvenience for some people, it's a make or break. Okay, that amount of money is financially terrified. It's even the cause of divorce in certain cases. It has broken off marriages because one of the partners wants to proceed, wants to keep on spending the money, and the other one is more practical.
Right. So not only that, but as you said, these require daily treatments, and in the case of somebody with severe autism, compliance is going to be very difficult. I mean, you would never be able to sit my son down in a chair, right, and say, okay, hold still while I apply this magnetic wand, right, to the left side of your brain. I mean,
I
that
will
wouldn't
tell you, we had many stories, and many of our patients not only require the net the one, but they require like a net of electrodes over their head, which those that were very sensitive would actually pull away the net, and that net alone was worth a lot of money.
Mm-hmm.
Uh, we had to train the patients, bring them in, answer questions. We had figures written in cards explaining everything. We allowed not only for the parents, but even for like ABA therapies and other types of therapies to come along with the patients, because they were also a source of comfort and friendship.
Mm-hmm.
So we did our best in terms of training the patients before proceeding to the actual examination. Still, many patients we couldn't test because one patient would only take things if they were the color green, okay? And
Okay.
the net would have to be green.
Mm,
And we couldn't adapt ourselves to those exigencies.
right. So what do you think, like in the end, if we're going to summarize, kind of the pros and cons here of TMS in autism? I think I might be summarizing this poorly. The pros are that there's evidence that it can benefit the autonomic nervous system. That could include heart rate, that could include sleep. I don't know I can't remember what else. The negative, and another pro is that in people with high functioning autism, at least, there is some evidence that it can help with repetitive behaviors and
Mhm.
also some core kind of social symptoms
Mhm.
of autism. Am I summarizing that
Yes,
correctly? Um,
perfect.
and the cons are that in cases of severe autism, we don't have data suggesting
Mhm.
that there's meaningful clinical improvement. We, of course, hear anecdotes, and people in the autism world, as you know, jump on anecdotes. Parents really want to hear encouraging stories.
Mhm.
Um, what would you do if you were the czar, right, of autism research? What research agenda would you create now to really ascertain what benefits there might be from this or related therapies for our community?
Yeah, I would probably develop a large, almost like a phase 3 clinical trial, where the total number of patients would allow for generalization into the whole population and for significance in terms of findings. That would include people of both genders, of different severity levels, of different races. So a big enough study is still
Mhm.
lacking. Also, I would probably suggest that long-term benefits, because the benefits sort of disappear with time, at least initially, and you may
Mm,
need booster shots.
mm,
Okay,
mhm.
so maybe they will need to come back after 1 year, get a booster shot, then come back after 2 or 3 years, and then that would be it. But that sort of natural history of the treatment needs to be examined over the long term.
Mhm.
And there are particularities, like we were talking about biomarkers. How do I make sure that the treatment is effective on the patients? Because otherwise it would be expensive and a waste of time and effort on everybody involved.
Right.
So the use of biomarkers is something that needs to be explored in terms of this technique. And another possibility still would be the concomitant use of other therapies, whether they would be neurofeedback, whether they would be anticonvulsant drugs used in conjunction with the TMS. There are several different possibilities that would probably add synergism to the findings.
Mhm. Right. Yeah. Very, very good question. And most of the people in our population are on medications anyway,
Mhm.
right? I mean, it's pretty rare to find somebody who's not, given the
Mhm.
behavioral and sleep and other
Mhm.
dimensions of the disorder. This is great information. We realize it's a little bit general for people, but if somebody really wants to pursue TMS, what should they do? I mean, I realize it's not necessarily covered by insurance. Maybe it is for some indications. I don't think it is for autism. Um,
Mhm.
what do parents do? They're like, hey, this is something I
Mhm.
want to try. Where would you refer them?
Actually, I side with many of the patients because I had a rule of thumb with my own grandchild that if an intervention didn't have side effects, but it had some science behind the scene,
Hmm.
I could try it. And TMS doesn't have a lot in terms of side effects. They are minor, and the people can get adjusted to any of them, like in terms of headaches.
Hmm.
I would probably recommend, uh, like when I was doing clinical trials, I never charged a single one of my patients, and they took a lot of my time, a lot of my time. So maybe go to clinicaltrials.gov and type in terms of key terms, TMS and autism. And you could also look for a region within the country and see what is available and whether that particular clinical trial is satisfactory for you. And then you can apply. The
Hmm.
other possibility is that some of the major TMS centers that are really reliable are those that are academically based. So go first to an academic institution, maybe a tertiary hospital that has a TMS unit, and talk to the people in charge. That would be my first suggestion. But otherwise, uh, you could also pursue other types of neuromodulation. I do not believe all that much in transcranial direct current stimulation. I think that the amount of current is very little, and it only creates probabilistic changes in neurons and their firing. It doesn't provide for anything else.
What was that intervention called?
Transcranial direct current stimulation,
Transcranial direct
current
current
stimulation.
stimulation. Okay, I'm
It's,
not
it's very
familiar.
big and it's sold as a panacea for everything. And it's not only
Hmm.
autism, but it's gambling behavior, smoking, whatever you want is being promoted as
Oh,
such.
interesting.
In the
Okay.
1920s, that sort of machine, and I have many, actually, part of my collection was
Hmm.
early electroshock devices, medical batteries.
Oh my gosh.
It was called quack therapy. And for me, it still remains like quack therapy,
Quack therapy.
regardless of the findings.
Hmm.
But neurofeedback is approved, and that could be an alternative, either with or without TMS. And it has been FDA approved for ADHD. So that subgroup of patients with autism that have ADHD, they may actually benefit from neurofeedback, but only after a large number of sessions, maybe after like 40 or so.
Wow.
Uh, yeah,
Okay. Well, thank you, Dr. Casanova, for blessing our podcast with your, I would say, Renaissance man like grasp of so many areas related to autism. It's really remarkable. And we'll look forward to your next book. And if people want to find out more about you, well, he does have a Wikipedia page, I found out. So you can read more about him. Again, I think this is your most kind of concise book for the lay audience, don't you think, Dr. Casanova?
yeah.
Yeah, it's called Defining Autism. I'm holding it up for those of you who can't listen. A Guide to Brain Biology and Behavior. Thank you. And I hope we will meet again on the podcast.
God bless. See you
Okay.
all.
Thank you. Thanks for tuning in to Autism Confidential. If you'd like to learn more, share an idea for an episode, or become a sponsor, please visit us at autismconfidential.org. The views expressed in this podcast are solely those of the individual speakers. Content presented is for informational purposes only, and we do not provide any medical or legal advice.